Question 1. A nurse is caring for a patient with asthma. Which of the following findings would the nurse interpret as a sign of worsening asthma? A. Decreased use of rescue inhaler. B. Prolonged expiration. C. Decreased wheezing. D. Improved peak flow readings. Answer: B. Prolonged expiration. Rationale. Prolonged expiration is a sign of airway obstruction, which is common in asthma exacerbations. While decreased wheezing might seem like an improvement, it can actually indicate severe airway narrowing and reduced air movement. Improved peak flow readings and decreased use of a rescue inhaler are signs of improvement, not worsening. Question 2. A patient with asthma is prescribed a short-acting beta-2 agonist. The nurse understands that the primary action of this medication is to A. Reduce inflammation in the airways. B. Relax bronchial smooth muscle. C. Decrease mucus production. D. Strengthen respiratory muscles. Answer: B. Relax bronchial smooth muscle. Rationale. Short-acting beta-2 agonists work by relaxing bronchial smooth muscle, which leads to bronchodilation and relief of acute bronchospasm. They do not directly reduce inflammation, decrease mucus production, or strengthen respiratory muscles. Question 3. A nurse is educating a patient with asthma about trigger avoidance. Which of the following triggers should the nurse include in the education? A. High-fat diet. B. Strenuous exercise. C. Warm humid air. D. Pet dander. Answer: D. Pet dander. Rationale. Pet dander is a common trigger for asthma attacks. While strenuous exercise can induce asthma symptoms in some individuals, exercise-induced asthma, it is generally encouraged with proper management. Warm humid air might be beneficial for some patients. A high-fat diet is not directly linked to asthma triggers. Question 4. A 7-year-old child with asthma presents to the emergency room with difficulty breathing. The first action of the nurse should be to A. Administer oral corticosteroids. B. Perform chest physiotherapy. C. Provide a short-acting beta-2 agonist by a nebulizer. D. Initiate oxygen therapy at 2 liters per minute viaduct nasal cannula. Answer: C. Provide a short-acting beta-2 agonist by a nebulizer. Rationale. The immediate priority in acute asthma exacerbation is to relieve airway obstruction and hypoxemia. Providing a short-acting beta-2 agonist by a nebulizer is the most effective initial step. Oxygen therapy may be necessary, but the initial focus should be on bronchodilation. Question 5. Which of the following diagnostic tests is most useful in the ongoing management of a patient with asthma? A. Chest X-ray. B. Sputum culture. C. Peak expiratory flow rate. D. Arterial blood gas. Answer: C. Peak expiratory flow rate. Rationale. Peak expiratory flow rate is a simple, quick, and effective way to measure how well a patient with asthma can exhale. It helps in monitoring the patient's asthma over time and in determining the effectiveness of treatment. Chest X-ray, sputum culture, and ABG are not typically used for ongoing asthma management. Question 6. A nurse is teaching a patient about the proper use of a metered dose inhaler, MDI, with a spacer. The nurse knows the teaching is effective when the patient states: A. I will breathe in quickly and deeply after pressing the inhaler. B. I will hold my breath for 5 seconds after inhaling the medication. C. I should shake the inhaler for at least 30 seconds before use. D. I will exhale completely into the spacer before pressing the inhaler. Answer: B. I will hold my breath for 5 seconds after inhaling the medication. Rationale. Holding the breath for about 5 to 10 seconds after inhaling the medication allows for better deposition of the drug in the lungs. Breathing in slowly and deeply is the correct technique, not quickly. The inhaler should be shaken, but 30 seconds is excessive. Exhaling into the spacer is incorrect. Question 7. Which of the following is an important nursing intervention for a patient experiencing an acute asthma attack? A. Encourage deep breathing exercises. B. Position in a high Fowler's position. C. Administer a sedative to reduce anxiety. D. Limit fluid intake to prevent fluid overload. Answer: B. Position in a high Fowler's position. Rationale: positioning the patient in a high Fowler's position, sitting upright, helps maximize lung expansion and facilitates easier breathing. Deep breathing exercises may be difficult during an acute attack. Sedatives are generally avoided as they may depress respiratory function. Adequate hydration is important and less contraindicated. Question 8. A nurse is assessing a patient with severe asthma. Which of the following findings would indicate the need for immediate medical intervention? A. Pulse oximetry reading of 95%. B. Presence of audible wheezing. C. Use of accessory muscles to breathe. D. Cough productive of clear sputum. Answer: C. Use of accessory muscles to breathe. Rationale: use of accessory muscles indicates increased work of breathing and respiratory distress, requiring immediate intervention. Pulse oximetry of 95% is within normal limits. Audible wheezing may be present in asthma but does not always indicate severity. Cough productive of clear sputum is common in asthma. Question 9. A patient with asthma is being discharged. The nurse recognizes the need for further teaching when the patient says: A. I will use my peak flow meter every morning. B. I know how to recognize the signs of an asthma attack. C. I should use my corticosteroid inhaler when I feel short of breath. D. I will avoid known triggers, like pet dander and dust. Answer: C. I should use my corticosteroid inhaler when I feel short of breath. Rationale: corticosteroid inhalers are maintenance medications used for long-term control and should not be used for acute relief of symptoms. Short-acting beta-2 agonists are used for quick relief. The other statements indicate good understanding of asthma management. Question 10. Which of the following is a side effect of long-term oral corticosteroid therapy in asthma patients? A. Hypoglycemia. B. Bradycardia. C. Osteoporosis. D. Hypotension. Answer: C. Osteoporosis. Rationale: long-term use of oral corticosteroids can lead to osteoporosis due to decreased calcium absorption and increased bone resorption. They can also cause hyperglycemia, not hypoglycemia, increased heart rate, not bradycardia, and hypertension, not hypotension. Question 11. A nurse is providing education on the use of a peak flow meter to a patient with asthma. Which statement by the patient indicates a need for further teaching? A. I will record my peak flow readings every day. B. I should use my peak flow meter after taking my bronchodilator. C. I will stand up to use my peak flow meter. D. I need to reset the meter to 0 before each use. Answer: B. I should use my peak flow meter after taking my bronchodilator. Rationale: the peak flow meter should be used before taking bronchodilator medication to accurately assess lung function. This helps in determining the effectiveness of the medication. The other statements reflect correct understanding of peak flow meter usage. Question 12. A nurse is assessing a patient with asthma. Which of the following symptoms would indicate poor asthma control? A. Nighttime awakenings due to asthma once a week. B. Using a rescue inhaler twice a week. C. Peak flow readings consistently at 85% of personal best. D. Mild shortness of breath after vigorous exercise. Answer: A. Nighttime awakenings due to asthma once a week. Rationale: nighttime awakenings more than twice a month are a sign of poor asthma control. Using a rescue inhaler more than twice a week, peak flow readings less than 80% of the personal best, and shortness of breath during normal activities are other indicators of poor control. Question 13. When evaluating a patient's use of a metered dose inhaler, MDI, which of the following actions indicates the need for further teaching? A. The patient shakes the inhaler before use. B. The patient inhales slowly and deeply while activating the inhaler. C. The patient waits 1 minute between puffs of the same medication. D. The patient exhales sharply immediately after inhaling the medication. Answer: D. The patient exhales sharply immediately after inhaling the medication. Rationale: the patient should hold their breath for about 5 to 10 seconds after inhaling the medication to allow it to settle in the lungs. Exhaling sharply right after inhalation can expel the medication, reducing its effectiveness. The other actions are correct techniques for MDI use. Question 14. A nurse is caring for a patient with asthma who has been prescribed a long-acting beta agonist. The nurse understands that this medication A. should be used for immediate relief of asthma symptoms. B. is typically used in combination with an inhaled corticosteroid. C. can increase the risk of asthma-related death if used alone. D. both B and C. Answer: D. Both B and C. Rationale: long-acting beta agonists are usually prescribed in combination with inhaled corticosteroids for long-term control of asthma symptoms and should not be used alone due to an increased risk of asthma-related deaths. Long-acting beta agonists are not meant for immediate relief of symptoms. That's the role of short-acting beta agonists. Question 15. A nurse is teaching a group of asthma patients about self-management. Which statement by a patient indicates an understanding of peak flow monitoring? A. I should only use the peak flow meter when I have symptoms. B. A reading in the red zone means I should continue my current medications. C. I need to establish my personal best peak flow reading. D. The peak flow meter is less accurate than my symptoms in judging my asthma. Answer: C. I need to establish my personal best peak flow reading. Rationale: establishing a personal best peak flow reading is essential for effective self-monitoring in asthma management. This reading helps in determining the patient's normal lung function and in identifying changes or exacerbations. Peak flow monitoring should be done regularly, not just when symptoms are present. A reading in the red zone indicates a medical emergency, requiring immediate action. Question 16. Which of the following is a potential side effect of inhaled corticosteroids when used for asthma management? A. Oral thrush. B. Tachycardia. C. Hypertension. D. Hyperglycemia. Answer: A. Oral thrush. Rationale: oral thrush, a fungal infection in the mouth, is a common side effect of inhaled corticosteroids due to the deposition of the medication in the oral cavity. Rinsing the mouth after each use can help prevent this. Tachycardia, hypertension, and hyperglycemia are more commonly associated with systemic corticosteroids or beta agonists. Question 17. A nurse is caring for a child with asthma. The parent asks about exercise for the child. The best response by the nurse is: A. Your child should avoid all forms of physical exercise. B. Swimming is a good exercise option for children with asthma. C. Exercise isn't recommended for children with asthma. D. Only light activities like walking are safe for your child. Answer: B. Swimming is a good exercise option for children with asthma. Rationale: swimming is often considered a beneficial form of exercise for individuals with asthma because it builds up the muscles used for breathing and the warm, moist air is less likely to trigger asthma symptoms. Physical activity should not be completely avoided in children with asthma, but it should be managed with appropriate medication and precautions. Question 18. A nurse is providing education on asthma management. Which statement by the patient indicates a need for further teaching? A. I can use over-the-counter antihistamines to manage my asthma symptoms. B. I should avoid exposure to tobacco smoke. C. I need to take my maintenance inhaler even when I'm feeling well. D. I should get a flu vaccine every year. Answer A. I can use over-the-counter antihistamines to manage my asthma symptoms. Rationale. Over-the-counter antihistamines are not effective for managing asthma symptoms and should not replace prescribed asthma medications. Avoiding tobacco smoke, taking maintenance inhalers as prescribed, and getting annual flu vaccines are all appropriate strategies for managing asthma. Question 19. In teaching a patient about the correct use of a dry powder inhaler, DPI, the nurse should include which of the following instructions? A. Use a spacer with the DPI for effective medication delivery. B. Inhale quickly and deeply through the DPI to draw the medication into your lungs. C. Hold the DPI upright and shake well before use. D. Exhale into the DPI before inhaling the medication. Answer B. Inhale quickly and deeply through the DPI to draw the medication into your lungs. Rationale. Dry powder inhalers require a quick and deep inhalation to effectively draw the powdered medication into the lungs. Unlike metered dose inhalers, DPIs do not require shaking before use and do not work with spacers. Exhaling into the device can cause the medication to clump and become less effective. Question 20. A nurse is caring for a patient who is experiencing an asthma exacerbation. The nurse understands that which of the following medications is most appropriate for quick relief of asthma symptoms? A. Inhaled corticosteroids. B. Long-acting beta agonists. C. Oral corticosteroids. D. Short-acting beta agonists. Answer D. Short-acting beta agonists. Rationale. Short-acting beta agonists, such as albuterol, are the medication of choice for quick relief of asthma symptoms during an exacerbation. They act rapidly to dilate the bronchi. Inhaled corticosteroids and long-acting beta agonists are used for long-term control of asthma, while oral corticosteroids may be used for severe exacerbations, but not for immediate relief. Question 21. Which of the following educational points is crucial for a nurse to emphasize to a patient with asthma who is prescribed a long-term oral corticosteroid? A. You can abruptly stop taking the medication when symptoms improve. B. Long-term use can lead to weight gain and fluid retention. C. Oral corticosteroids are primarily used for quick relief of acute symptoms. D. Inhaled corticosteroids are more effective than oral corticosteroids. Answer B. Long-term use can lead to weight gain and fluid retention. Rationale. Long-term use of oral corticosteroids can cause systemic side effects such as weight gain, fluid retention, increased blood sugar, and susceptibility to infection. It is important not to abruptly stop taking these medications due to the risk of adrenal insufficiency. Oral corticosteroids are not primarily used for quick relief, they are used for severe exacerbations. Inhaled corticosteroids are preferred for long-term control due to fewer systemic effects. Question 22. A nurse is educating a patient on recognizing signs of an impending asthma attack. Which of the following should the nurse include? A. Increased energy levels. B. Decreased need for rescue inhaler. C. Coughing, especially at night. D. Improvement in peak flow readings. Answer C. Coughing, especially at night. Rationale. Coughing, particularly nocturnal coughing, can be an early sign of an asthma exacerbation. It is important for patients to recognize early warning signs like increased coughing, chest tightness, or wheezing. Decreased need for a rescue inhaler and improvement in peak flow readings are signs of good asthma control. Question 23. A patient with asthma is instructed on using a peak flow meter. Which of the following indicates the patient understands peak flow monitoring? A. I will compare my daily peak flow readings to the normal values for my age. B. I will use my peak flow meter to decide when to take my rescue inhaler. C. I will record my peak flow readings and bring them to my next doctor's appointment. D. I should only use the peak flow meter when I'm having symptoms. Answer: C. I will record my peak flow readings and bring them to my next doctor's appointment. Rationale: recording daily peak flow readings and sharing them with healthcare providers is crucial for monitoring asthma control and making necessary adjustments to the treatment plan. Peak flow readings should be compared to the patient's personal best, not normal values for age. The meter helps in managing asthma but should not solely dictate when to use a rescue inhaler. Question 24. The nurse is assessing a patient with asthma and notes a high-pitched wheezing sound on expiration. This finding is most indicative of A. Upper airway obstruction. B. Normal lung function. C. Air moving through narrowed airways. D. Fluid in the alveoli. Answer: C. Air moving through narrowed airways. Rationale: high-pitched wheezing, especially on expiration, is indicative of air moving through narrowed bronchial tubes, which is common in asthma. It is a key finding in asthma exacerbations. Upper airway obstruction typically produces stridor, not wheezing. Wheezing is not a sign of normal lung function, and fluid in the alveoli is more characteristic of conditions like pneumonia, which produce crackles rather than wheezing. Question 25. A patient with a history of asthma is being educated on managing exacerbations. The nurse should advise the patient to seek immediate medical attention if they experience A. The need to use their rescue inhaler more frequently than every 4 hours. B. A slight decrease in peak expiratory flow rate, PEFR, from their personal best. C. Mild coughing after exposure to cold air. D. Temporary relief of symptoms after using a short-acting beta agonist. Answer: A. The need to use their rescue inhaler more frequently than every 4 hours. Rationale: needing to use a rescue inhaler more frequently than every 4 hours can indicate a severe asthma exacerbation and the need for immediate medical attention. A slight decrease in PEFR from the personal best is not necessarily an emergency, but it should be monitored. Mild coughing after cold air exposure and temporary relief of symptoms after using a short-acting beta agonist are not uncommon in asthma, but do not typically indicate a severe exacerbation requiring immediate medical attention. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.